Hello, my name is Finn Allen. I'm one of the senior product managers here at SHOEBOX Limited, and I'm here today to talk to you about the different products that we have available at SHOEBOX and then take a deep dive into SHOEBOX Online. So here at SHOEBOX, we're all about thinking outside of the booth. How can we grow your practice and enable you to do more without the limitations of your booth? So I'm Finn Allen. As I said, I'm the senior product manager here at SHOEBOX. My main role is really getting curious about customer problems and trying to solve them with innovative new solutions that adapt to all the latest technology that we have. Here at SHOEBOX, we have a bundled solution called Satellite, and within that product set you get SHOEBOX Pro, which is a diagnostic iPad-based audiometer that can do threshold testing, air, bone, speech, and you can do all that outside of the booth. We then have SHOEBOX Online, and this is going to allow you to test people in their own homes with their own equipment and get a good screening idea of where they are in their hearing health. And then we have SHOEBOX Quick Test, which is designed for high traffic environments where it might be very noisy, and it allows you again to screen and help people on that hearing health journey. So today we're going to take a deep dive into SHOEBOX Online, and what I'm going to do is I'm going to take you through a 3-part series where we're going to do a product overview, we're going to look at how and where you can use it, we're going to do a setup and demo, and hopefully through this you'll be able to see which parts of those elements that you'd like to use and how you might actually apply them in your day-to-day practice. So let's jump into SHOEBOX Online and part 1. Part 1, we're going to give you an overview, we're going to look at why SHOEBOX Online, and then we'll look at what makes SHOEBOX Online unique. So SHOEBOX Online is a revolutionary new online hearing screening test. It allows you to to place it on your website or send somebody a unique link, and one of your patients can take these tests in their own home with their own equipment at their own convenience. They can do it a couple of times so that they get a good idea, and it can help them on that journey to taking action towards getting help. It has a high degree of screening accuracy, and I'll take you through, how good we are at screening for hearing loss, and then how you can use that to move patients forward. So why SHOEBOX Online? Well, we've spent the last year working on this product to developing and overcoming the challenges of and the difficulties of testing with people's own uncalibrated equipment, their own hardware. You're not there to guide them, so you've got to build a really great, solid user experience. So, we really think that SHOEBOX Online can increase the participants' awareness of their own hearing health. And the way it does this is it's simple, it's engaging, and it's user-friendly. So you can see the results on the right. There's, these are simple graphs to understand. You can understand if you have good hearing, or if you have a bit of hearing loss, or if the test thinks you have quite a significant hearing loss. So when the participant completes the test, they get classified into different hearing loss degrees, and it can help them start self-education. It can help them on that journey to making that next step. There was a study done that showed that the last step before purchase really starts with self-education and educating yourself. Do you have a problem? And this usually happens online. So we need to meet these people where they're starting to be curious, and then be able to test them at that point simply, and help them understand what are the next steps. And it's all configurable so that you can choose what that next step is for the patient, and then we're going to help you motivate those participants to take action on that journey with you. So what is unique about SHOEBOX Online? And as I said, we spent a year developing this product, and I really think it comes down to 3 core pillars. Simple, it's got effective categorization, and it's mobile ready. So let me jump into what we mean by these. Well, and when I mean simple, simplicity can be really hard. So to make sure that everyone understands what you're asking them to do, and everyone does the same action, you've got to use simple language. You've got to try and get to like grade 5. You've got to have a really simple flow that there's no way that they can get stuck, or they can go the wrong way, or they can select something that they didn't mean to. You need really simple, clear instructions so that they know what they're going to, they know how long they're going to need. They're going to know what they need to do, and they're aware of everything that we're asking of them. And then you've got to have simple results so that they can digest, the result that we've given them, and then choose how to proceed. So we've optimized the product for both mobile and desktop. So whether you're whatever type of device you're doing this on, the product will scale and modify itself to make it really easy and simple for you to complete. You can seamlessly integrate this into your website. It's just as simple as copying and pasting a link into one of your page. And again, the participants can use the equipment they have at home, and especially in times where either you've got reduced mobility, or we can't go out as much, or you have a higher risk of getting ill and you don't want to visit a clinic right now. This is a great way to allow them on that journey, to explore where they are right now. So what makes SHOEBOX Online unique is really our approach to, our prediction of does somebody have hearing loss or not. And what we use multiple factors to correctly classify someone and communicate with participants about their hearing health. We've really taken a data-driven approach to this. So we don't just use one test like a tone test. And think about this in your clinic. You don't just rely on one test. You rely on multiple factors of tests to really help you understand where that patient is. And you have constraints, even in a booth, and online we have constraints as well. So we're taking the elements that best adapt to the constraints that we have, and then we're adding them together so that we can get the best results for your patients. So the first thing that we do is we take a device and transducer compensation. So we've measured dozens and dozens of headphones and devices, and we're able to compensate for those different things. We have a dynamic predictive questionnaire where we ask people about their experience and what it means to them, and what we're really looking for is how much does it impact you today, and how do you feel about that impact. The next thing is we have a new patented test methodology called dynamic range. The way that this works, and it's based on a study from 1988, is we look at their most comfortable level and the lowest level they can hear, and then we measure the distance between those levels, and based on that gap you can predict the type of hearing loss somebody has. As an example, if somebody has 5 to 10 dB of hearing loss, that gap will be around 60. If somebody has 80 dB of hearing loss, that gap will be around 20. So the smaller the gap, the higher the hearing loss. The next thing that we do is we look at multi-frequency tone detection. So we're looking at multiple different frequencies and looking at the lowest sound that they report they can hear with the test equipment they have. And then coming soon that we're working on is really looking at what kind of shape of hearing do they have. Is it flat? Is it sloped? Those kind of things. So, it really is a multifaceted approach. And what I'll do is I'll take you through the accuracy. We can jump to that right now. So, when we look at accuracy, we're always looking to improve it. So we're always looking at a data-driven approach. So the results that I'm about to show you are as of 3.8 July 2020. So if you're listening to this in the future, which I'm sure you are, because everything will be the future from now, please do check back with shoebox.md to find out what the latest results are. So SHOEBOX Online can effectively categorize people through screening accuracy with a 93% screening accuracy. And what that means is we're really looking at does somebody have hearing loss, or do they have good hearing? And that's what we're really looking at. We're looking at that first funnel of the journey, that first touch point of, should I take action, or am I okay and I just need to come back and check in a year? This is really, a tool that's going to start right at the start of that journey for you. It's not designed to replace your audiometer. It's not designed to replace the booth. It's designed to reach people earlier in that journey, way before they'd ever come into your clinic. So getting deeper into the screening accuracy, our sensitivity is 95% and specificity 91%. So sensitivity is how well we tell somebody who has hearing loss that they actually do have hearing loss. And specificity is how well we tell somebody who has good hearing they actually have good hearing. So we do much better at telling people with hearing loss. We're both into the 90s, but for people with hearing loss, we're much more precise. And this is for at least for two reasons. The first reason is, if somebody has hearing loss, we really don't want to tell them they're good. And if somebody isn't quite at that threshold for hearing loss, but we do encourage them to visit you, it's likely that over the course of the next 5 years that they will move into that category. So it's better to over-refer than under-refer, in our opinion. So that's a deep dive into, how effective SHOEBOX Online is, and I'll jump back into explaining more about the product. So, what can you do with SHOEBOX Online? Well, you can customize the branding, you can replace the color, you can replace the logo, and at the end of the test, you can place a custom call to action button that could take them back to your website. It could take them to a booking page, or it could take them to a PSAP or an OTC device page. And additionally, you can turn on call to action that allows you to do that. The next thing that we've done is we've localized this into 11 participant languages, so you can set up and enable 1 to 11 languages on your site. So when the participant lands on that page, they get to choose this in the language that makes the most sense to them. And we've also just released contact capture, so you can turn on the ability to capture contact information when the participant is completing the test, and this will allow you to collect information for participants to request a follow-up and for you to contact them and discuss their results with them.